Blended Podcasts. Brought to you by Blended Audio.
What does a healthy, balanced lifestyle consist of? How should you eat? What exercise should you be doing? How many hours of sleep do we really need? Does too much water flush away all your vitamins? Should it be high carb, low fat, or high fat, low carb? The more research you do, the more confusing it gets, because there is so much information out there, and there are so many conflicting opinions. So how are we supposed to know? Stick around to explore the different approaches to health with us, physically, mentally, and emotionally, and let's try to figure out together what the heck being healthy really means. I am your host, Hazel Priscilla, and this is your weekly dose of Feed Me Honesty. Hello and welcome back. You are listening to Feed Me Honesty, and today's episode is a follow-up to an earlier episode we did last month called The Can in Cancer. Previously, we spoke to cancer survivor Megan Randall about her personal experiences and the lessons she's learned, and today we have the person in studio who Megan admits was one of the biggest rocks throughout her journey. This woman was there to assist and guide Megan through all the ups and downs, just like she does with so many other patients. Sister Dale Heim has 30 years experience in the allopathic and now also alternative integrative medical world, so it really is a huge honor to have her expertise in studio today. Sister Dale, welcome to Feed Me Honesty, and thank you so very much for agreeing to talk to me today.
Thank you, Hazel, and hello, listeners.
So let me just quickly fill our listeners in on what topics we will be taking on in this episode. First, we will discuss the use, importance, and healing properties of the full cannabis plant and why we as humans are perfect for these cannabinoids, since Sister Dale has 20 years of hands-on experience in this specific field. Then we will also talk about the bridge between disease and the healing of the mind, which is the journey Sister Dale guides patients through. Lastly, we will take on a subject no one really likes to go near, which is how Sister Dale prepares patients to leave a legacy and assists them with how they wish to pass on. I cannot wait to hear what Sister Dale has in store for us, so let's jump straight into the questions. Dale, please tell us how and when your enthusiasm for the cannabis plant was born, and why you choose to be involved in healing with plants rather than Western medicine, or do you use a combination of both?
Hazel, as the title of your podcast says, Feed Me Honesty, this is what I aspire to do today. Some 20 years back, I found myself running a hospice in KwaZulu-Natal in the sticks. And I had some 25 patients. I had an oncologist who would come through once a month, and he would help me with my patients. But this oncologist taught me the healing properties of cannabis. I found an old farmer of 75 years old who grew cannabis, and he made a tea for himself and his wife, and they drank this tea on a daily basis. He claims it was fabulous for his immune system, and it also helped them sleep and for stress. So I merrily went along and made tea with cannabis leaves.
How does it taste, by the way?
Not so great, but I mixed it with chamomile.
Okay.
And whether it was the chamomile or the cannabis that was working, my patients did definitely, their stress was reduced. But my biggest problem with most of my patients, because they were on chemotherapy, was the nausea. So I learned very quickly that to smoke a joint helped with the nausea.
Oh, really? Yeah.
Very much so. And a super story is a young girl of 16, Lizzie. She was on her last legs because she suffered from cancer for a very long time. And I suggested to her family that she smoke a joint.
Yeah.
One of Lizzie's problems was she was ataxic. And
what does that mean? Sorry, I don't...
Ataxic means she was very wobbly on her feet.
Oh, okay.
And also she had no appetite. She was rather emaciated.
Yeah.
So the family agreed, and Lizzie, thank heavens at 16 years old, they know how to smoke. And she smoked a joint. And the immediate effect was Lizzie could walk from A to B.
Oh, wow.
She had the munchies, because everybody knows that cannabis gives you the munchies. And
which was a good thing in her case because she wasn't eating. Yeah.
Very much. But the beauty of this was that because she was no longer ataxic, and cannabis gives you a good feeling in the brain, a feeling of well-being. she was able to spend her last couple of months on this earth plane with her family, with quality of life.
Yes, which is so important.
Yes, they actually went away on holiday. They took a caravan, they went down to the seaside, and they had a ball. So she had a really good last few months on this earth plane thanks to cannabis.
That is such a beautiful story. Thank you for sharing that with us. Now, can you talk to us a little bit more about the healing properties of the cannabis plant and why we as humans are perfect for these cannabinoids, as you mentioned to me?
Well, that's easy. There's one word: endocannabinoids. Endocannabinoid receptors are found throughout our body, in the brain, the connective tissue. And endocannabinoid, simply translated, means cannabis-like.
Okay.
So when the body sees cannabinoids from cannabis, it knows what to do with it.
Okay.
The healing properties as far as cannabis is concerned, I'll only cover that it is an anti-inflammatory. I myself take cannabis. And
on a daily basis?
I do, on a daily basis, because it's an anti-inflammatory. So I address inflammation. And I know for a fact it just takes pain away. But it also gives a patient a feeling of well-being. And this is very, very important when you're dealing with cancer patients, as it tells the brain, I can cope with this rubbish that's going on around me.
Would you say there's a better form in which to take it? Like, what's the difference between the tea? I know that you said the smoking helps with nausea, but then there's also the oil. Is there different uses for them, or is it just like whichever you prefer?
When I referred to 20 years ago, remember we didn't know how to make the oil in those days.
Yeah,
we only knew how to use the tea or
smoke
it. Today, the oil is extracted, and it is very potent. So this is the one that works for inflammation, pain, and a feeling of well-being. When it is extracted and only just put into a tincture, which is an alcohol base, it is used for stress and for sleep.
Okay. So the thing that comes to mind when we talk about the oil, I know because I already told the listeners in a previous episode about my father and his journey and him using cannabis oil for his stage 4 cancer. I know sourcing that oil, because now obviously everyone's jumping on the bandwagon, everyone wants to make money, and now, with the legal stuff coming in, more and more people want to jump on the bandwagon. Then you obviously just have to make sure that you get it from the right provider. How do you go about knowing, or like how can you do research? We knew someone who knew someone who knew someone, so we were lucky and we knew where it was coming from, and had you been using that before. But if you don't know anyone who supplies it, how do you even start researching, or how do you know if you're getting the right product?
A very good question, and thank you for asking me this. Because I say to patients, every dog and his granny are suddenly a whiz overnight on growing and selling cannabis.
And with everything in life, not even just cannabis oil, everything, everyone thinks they know better.
And the fundamental truth on cannabis is, where's it grown?
Yeah.
Where is it grown?
Is it about the soil?
Very much.
Okay.
Is it grown in living super soil? I'll say that again. Living super soil. No pesticides and no fertilizers.
Yes.
Now, who's heard of that?
Yeah.
Everybody thinks you grow it in a little greenhouse and it's going to be safe. No, it must be grown the same way you would grow a sprout that you need for the microbes in your system, is exactly the same way that you would grow your cannabis. So you ask me, where would you buy it?
Yes.
Difficult answer.
Yeah.
Difficult answer, because people are not allowed to sell cannabis.
Yeah.
And if I ask somebody, or I teach somebody to grow their own cannabis at home, the first thing I would teach them is how to grow their own soil.
And how long does it take for this plant to grow?
A long time.
And then obviously you need to make the oil yourself. So do you teach people to do that too?
This is something that they can learn. Yes.
Do you know how to do it yourself?
Yes.
Awesome.
This is something that we do.
That is wonderful. And I suppose it's like a very fun experience to see where it comes from, to make it and then to consume it.
Very much. So I do urge people that if you do not know where the cannabis is grown, don't go there.
Rather not take it then.
Rather not take it. If you ever thought of a compost heap, people throw batteries into a compost heap.
Yeah,
and they use that compost to grow cannabis.
Yeah.
So you're getting all that battery acid.
You're getting the opposite effect of trying to heal yourself. You're making it worse.
You are starting off on a back foot.
Okay. So rather try to grow it yourself, and if not that, then do a proper research before you just buy from anyone.
Very much so.
Okay. I think I interrupted you when you were going to say how long it takes for this plant to grow. Did you tell me?
I didn't tell you because from start to finish, it depends on the climate and it depends on where you're growing it. But I will tell you that it depends on what you're feeding it.
Okay, so what do you feed it? What should you be feeding it?
Super soil.
Oh, like you said.
Super soil, yes.
So in that case, maybe 5 months? Is it months? Is it years?
It is almost 5 months because you want...
Well, that was a wild guess.
You grow your own. You're just not telling us.
No, I honestly have never, but that sounds like a good time for a plant to grow.
I will tell you that if you start growing your own cannabis plant, you want the yield to be 4 times the amount of an average yield.
Okay.
And that is where the super soil comes in.
Because then it's a good.
The whole secret of this, the whole secret of getting the best cannabinoids, I beg your pardon.
You taught me that word, so yes. I'm happy to help.
The best cannabinoids from a cannabis plant, it depends on the soil in which it's grown.
Okay, so listeners, take that tip from the professional. You said in an email to me that 55% of all healing occurs in the mind, and I have to say I truly believe that in my soul. Please explain to us how the mind plays such a massive role in the healing process.
When you're talking to me now, we are using our brain. But if you think about the mind or the subconscious, this is an energy field. I subscribe to Dr. Dietrich Klinghardt of the Sophia Institute in Washington, and I follow his 5 levels of healing. I'm only going to cover the first 2 levels. Level 1 is healing of the physical body. That's your taste, smell, sight, hear, and touch. But this ends in your skin. Level 2 is the energy body. It's the electric body. And this is where we claim 55% of healing occurs. To understand the energy or the electrical body, you must think of the autonomic nervous system, which runs down the longitudinal axis of the body. So think about that from top to toe. Yeah. You've got nerves running. And there's a current between each nerve. This current creates a magnetic field, and this magnetic field holds the memories. It's called the nocebo effect in medical terms. A patient's mental field can be healthy and can be sick, and these illnesses require different kinds of interventions. It's very important to disconnect a sick patient from the mental consensus field of his or her illness.
Yes.
And I start with, in my field, I work within my scope of practice, remembering I'm a nursing sister, and I start with mere positive affirmations. For example, when a husband says to a wife, you're never ever going to get well, that's a negative affirmation. Yes. I want something positive. Yeah. But a perfect example is where a doctor says to a patient, you've got 3 months to live.
Yeah.
No, blow me down dead.
Yeah.
This is not something...
Because that's immediately your expectation.
That's right. And this is what the mind absorbs this. Yeah. So you have to start reversing that in the mind.
And can I just interrupt you there? How about talking about cancer so much? Because I felt like when we never as a family ever spoke about cancer, and then immediately as soon as my father was diagnosed, that was literally the only thing we ever talked about, because and we noticed that, and then we said, okay, we're not going to acknowledge that this is happening, but let's just stop talking about it, because literally from the morning to the night, if you're not talking about it because you're handing out medication or you're dealing with it, then someone else is asking you about it. So it's like almost you can't get away from it. So do you think constantly talking about the disease is also keeping you from, healing or not?
Not necessarily.
Okay.
Not necessarily, because when a patient has been newly diagnosed with cancer, it's like a rabbit in the headlights. And they are looking for answers. They want to talk about it.
Yeah, they want to come to terms with it.
They need to come to terms with it. But it is coming to terms with it, because I say that cancer is a tap on the shoulder, no more than a tap on the shoulder.
We actually just had that discussion earlier about any disease where it's a teacher. It's actually trying to teach you something. That's right. So you should just take the lesson.
That's right.
And move on.
What is it trying to teach you?
Yeah.
And this is where you get back to the energy field. What is it in your energy field that is stopping you from healing.
Yes.
And here I'm going to go into the healing properties of Dr. Dietrich Klinghardt that he uses for the energy field. He goes as far back as a patient who's got cancer or just a patient who's mentally sick. He uses what they call family constellation, where they go back into, was the grandfather in the World War?
So like other generations.
Yes,
I've heard
very,
about
very
people like getting trauma and stuff in the womb and then like having that, but I've never heard
That's
about
right.
previous generation kind of things.
Dr. Dietrich Klinghardt goes back very, very, very far, but he is a man who has been doing this for many years, so you can trust him in what he does.
Because he wants to get to the root, obviously.
Very much so. So he gets the patient to talk about it, feel it, work through it. There are other forms of tapping into the psyche or the energy field of the patient, and those are kinesiology, hypnosis. I often say to a patient, if I give you a lot of cannabis, that THC opens up your mind, and it's almost as if I'm giving you a torch.
Does it create new thought patterns or not?
No, it takes you into your psyche.
Okay.
And if I give you a torch and I say to you, shine a torch on all those heavy suitcases at the bottom of the cellar.
Yeah.
Go and open these suitcases and see what it is that is disturbing you from years and years and years ago.
Yeah.
When you open up these can of worms, the can of worms bite me far more than me as a nursing sister can actually deal with.
Yeah.
And I'll give you a good example. A patient came to see me. He just wanted to be guided he had prostate cancer, and he wanted to be guided into who to see, which doctor to see, what therapy could he do, which is something that I do. And I said to him out of the blue, you wear your heart on your sleeve. And I said, you are very, very, very obsessed with something that has happened in your life.
Yeah.
And his wife went ballistic, and she said, I told you so, somebody's spoken to her, somebody's spoken to her.
Okay.
And I said, ma'am, it's not that I know. I'm picking up his vibration.
Oh, wow. I've heard about that so many times.
Which is very, very, very potently inhibiting him to heal.
That picking up a vibration, is that something that you learned over the years, or is it something you've always had a natural thing for, like since you were a child, or is it because you've been working with people and you've been exploring this field that you feel like you've become more conscious and more sensitive for these things?
Is this a good question, or is it a question where I'm really putting my heart out there? I was brought up with a mother who was a psychic.
Okay.
I was brought up with a grandmother who did hands-on healing. I spent many, many, many years studying the Hindu religion. So I believe in the energy field.
Yes.
I believe in it emphatically.
Do you think it's also a talent for the people who are doing it as a profession, or do you think some people are more talented in that case, or do you think it's just something that you need to almost develop or make room for in your life everyone has that talent?
Do you know that we all have that ability?
Yeah,
if you go inside and you are quiet and you listen to what your body is telling you, you will be able to address the problem and you will be able to heal. Because the body is built to heal.
Yeah.
That's what it's meant to do.
And its natural state is healthy. I think so many people think the natural state is sick or stressed or what, and then we need to get it back to healthy. But that's the natural state, and I think that's what we all forget and should remember.
I can still hear my mother saying to me, and my grandmother saying to me, meditate, listen, and learn. Can I move back to that one patient I was telling you about?
Yeah, please. Sorry for interrupting you.
No, it's quite fine. When he was chatting to me, he just suddenly blurted out and he said, my father committed suicide in front of me when I was 11 years old.
So he knew exactly what it was.
And he said, I have never been able to move forward, and I can never ever be a success in my life. And I said to him, my sweet man, stop there, because this is a can of worms. I need to refer you to somebody who has the jelly beans to work through this with you.
Yeah.
And that is where I fit into people's lives. I do not work through cans of worms. I'm not a psychologist. I don't purport anybody should see a psychiatrist, but a psychologist. And every dog and his granny becomes a life coach because they've been through this, done this. I've got the T-shirt.
Yeah.
Now I can talk you through a can of worms. No, you can't.
So this story just makes me want to ask the question, why do we need to be at our deathbed almost for us to deal with something? Because obviously this happened when he was 11. He never dealt with it. How old was he when you met him? Was it 32
in his
or in his 20s? Oh, that old. So for 50 years he carried this and he never dealt with it. So why don't we just deal with something when it happens? And do you encourage people to, when something happens to you that you know is like shocking you a bit, or doesn't feel comfortable, or it's something big that changes your life, to deal with it? Because it will manifest in cancer or whatever else later on in life, because you carry it and it becomes bigger. I think the longer you carry it, the bigger it becomes. So then it becomes harder almost to deal with it as well.
1,000,000%. And I do give you examples when I talk about walking people through their legacy, and I do give you examples of what I do.
Okay.
But I'm going to take you as an example. You're a very young lady. You're a very confident lady.
Oh,
but
I hide it well then.
You're very confident. And if you are hiding things, or you ever feel that there is something you need to work on, what is the first thing you would go and work on? You would work on your own self.
Yes.
And I say to everybody, if you want to be perfection in this life, you must be selfish. You must be selfish.
Yes.
You cannot give of yourself unless you are 100% okay with who you are. And I think that does come with age, because, listeners, I'm not telling you my age, but I am old. But
she doesn't look old. She doesn't.
This young lady opposite me is in the prime of your life.
Yeah, I'm 26.
And you should go and look at all the psychic healings. Go and have your chakras aligned. Go and use methods like as simple as flower essence. Because when you look at flower essence, it is subtle and it opens up, maybe you have a blocked chakra. And as you said, you don't want to wait for pain to develop in a certain area, because you possibly do have a blocked chakra.
No, I think we all do. I mean, we all
Not
have.
Not necessarily.
So what blocks you? Is it something that happened, or is it something you're born with, or is it genetics?
I think it's got to do with genetics, and I think it's also got to do with past histories.
Okay.
If you take someone who's been abused and they haven't worked through that, they definitely have got hang-ups, let's call it hang-ups.
Okay.
And that is where I say dis-ease. And from that dis-ease in the body can develop disease.
Okay. I think I have a question about that, so let's move on. That's a perfect pickup for me. You typed the word to me the first time in the email, dis-ease, and not disease. So can you now elaborate on what's the link between disease and dis-ease?
Dis-ease is when something is amiss in the body. Something is not in alignment. Something is not in tune. And I think each and every listener out there needs to go and look at their past history and find out if there is a dis-ease anywhere.
From when you were born, or do you need to look back to your grandparents and stuff like that?
Possibly from when you were born would be good enough, because you are very young. And to give you a very good example of this is a young girl I work with on it very, very often. She is 38 years old, and when her mother was pregnant with her mother was prescribed a medication that was contraindicated. And it resulted, they stopped the medication, took it off the market, doesn't matter what it was, and the baby was born with the most terrible nervous twitches. Now, this is a little girl who has had to go into every bit of her psyche, because during her life, she became anorexic, she became a drug addict. It was only when she was in a very bad car accident in ICU, woke up and thought, now I have to pull myself together, that she started to work on herself. And now at the age of 38, she is a very positive thinking young girl, and she works on her psyche on a weekly basis.
Yeah, that's also something that I think is worth saying. I once heard, they said, it's not like a college degree. It's something you have it down today, and the next day you have to do it again or start all over again. Sometimes you get it, sometimes you don't. It's not like once you got it, you're always going to get it right, you know.
And there are many, many ways of... I'm not saying to everybody, go just sit and meditate and be quiet. What are you going to learn? You do need to be quiet. You do need to learn about your inner peace. You do need to learn about who you are.
Yes.
And you do need to accept that you are born in total perfection, and I am perfect.
Yeah.
Because, as I said before, the body is here to be perfect. It's meant to heal.
Yeah.
It's
And
meant
so
to heal
smart.
itself.
So smart. So would you say that feeling dis-ease about anything, like whether it's something that physically happened or whatever, emotionally, mentally, does that then cause disease?
Yes.
Okay, that's the link.
Yes.
That's basically. Okay. And now for the more sensitive subjects, if you're ready for that. I know you yourself have no fear of death, and I also think I reached that point about 2 years ago. But I have to admit, I do prefer not talking or thinking about how I am going to die. When and how did you get over the fear of dying, or have you never really been afraid of death? And also, how do you prepare patients to leave a legacy and assist them with the choice of how they wish to pass on?
Hazel, death. It's our common denominator. We all know we're going to die.
Yes.
But it's the fear of how I'm going to die.
Yeah.
And very often I see patients who are on their last legs. They know that they don't have very, very long to go. And these are the people that walk into my office, and I walk them through their last months on this earth plane, last months, years, whatever, on this earth plane. It's all about quality of life and preparing yourself to die. So I'll give you an example. Linda, she knew she was going. She was on heavy morphine, heavy cannabis, but she organized her own memorial service.
My dad actually did that too.
Yes.
He paid
Yes.
for everything, and we were like, this is
Yes.
easy for us.
Easy
like
for
laughing. He was always that kind of guy who was so organized, even on his deathbed. It kind of became a joke.
Very much. But then another example of somebody who knew she was going to die was my aunt, and this was many, many years ago. She said to me, Dale, please make sure you are in my room when I'm on my last legs. She said, because I know I'll be unconscious, but I need to be beautiful. I need my wig to be in place. I need my makeup done. And that was what I did for my aunt.
Oh, shame.
Another example is, call him Peter. Peter said to me, I know I don't have long to live, but I would like you to be there with me when I die. And I said, where do you want to die? He said, I want to die at home with my 2 dogs. And this is exactly what we organized. His wife was around, and his 2 little schnauzers who slept on the floor at the bottom of his bed, never left his side.
Yeah,
during
animals are great like that,
Yes.
hey? They always know what's
Yes.
going on for some reason.
And when he was the last day of him being on this earth plane, his wife said to me, you and the doctor have now said probably he will pass on tonight. And she said, but how am I going to know that he is dead? I said, watch his 2 dogs. She phoned me at about 9:30 and she said, Dale, I can't believe this. She said at 9:30, Joe was breathing very shallow. She said both dogs jumped up onto his chest. He opened his eyes, he sat up, he looked around him, and he lay down and he died. And the dogs got off the bed.
So did he say goodbye to them? Or
No,
what
he just
what was
opened
that?
his eyes and he acknowledged everybody in the room and he died.
Yeah.
And she said, this was my cue to know that he'd actually passed. And it was the dogs.
And then they went off again. They knew what
Then they climbed off the bed, and they have an incredible sense to
Yeah.
animals, incredible sense.
It's so wonderful.
But you asked me also about a legacy, and I think this is even more important. When you are working through your psyche, be it in the last few months that you were alive, or be it at the age of 26, which you are, you have to think about what it is I am going to leave behind. Who is it in my life that I'm affecting? Your father affects you.
Yes.
A young mother of 38, I went through 4 years of cancer with her, where she fought
That's
tooth and nail.
a long time.
But when she finally passed, she left a legacy second to nothing. And the proof of this was a picture. She died on the Monday, but on the Saturday, for some unknown reason, her husband organized that the entire family and friends came around, and they all participated in a family friendship tree. And in the middle of this tree, her 13-year-old daughter who she'd seen through counseling over the past 4 years, had drawn a big heart. And in this heart, she depicted her mother as a huge big butterfly, yellow butterfly. Her father is a green butterfly. Her brother is a small little blue butterfly. She depicted herself as a dolphin. And the energy of a dolphin is nurturing and accepting.
That girl, the 13-year-old,
yes,
and that's very young for someone to have that instinct.
But her mother never once came across as a martyr. She allowed her daughter to work through the process.
Yeah. And everyone has their own process, even just looking at how my family members are all dealing differently with my father passing. So, allow yourself your own process. What works for you may not work for someone else, or I don't know, you probably know that better than anyone else.
I think I've sat with many, many, many people that have died. And if there's time for one more story, I'll tell you one more story. This happened a couple of months back where I had no idea why I was walking through the door. I was asked to go and put up a drip of a lady who was suffering from cancer. When I got there, the old lady was in her wheelchair, but she was moribund. And I thought, gosh, I don't judge. I don't say why. I do as I'm asked.
Yeah.
Not because I'm being paid to do it, but because it is the family's choice.
Yes.
I never make those choices. I give people choices.
Yeah.
And I tried to put up a drip on this lady because the daughter was insistent. Daughter was 33 years old. And I sat with the family for about 3 hours just watching. I couldn't get the drip up. There were no more veins. The daughter wasn't happy with this. She went and made a green juice and she used a syringe and she squirted this down Mum's throat. Mum swallowed. And I realized suddenly what the connection was.
Between the mother and the daughter?
Yes. And as I was leaving, I said to the young daughter, your mum, in my experience, is waiting for something. And I said, I kept thinking she was waiting for somebody to arrive. I said, my girlie, she's actually waiting for you to come to terms with the fact that she's leaving.
Yeah.
And I said, she's giving you a chance to process. Yeah. It took this young girl of 33, that's very young.
Yeah.
About 3 days, she came back to me and she said, Sister Dale, thank you so much for allowing me to process this. She said, I collapsed on the kitchen floor and cried my eyes out, but I went through counseling. She said, after 2 days, I went to my mum and she said, I told my mum it was okay to go. And she said, I watched my mum shed a tear and it was the first time we had communicated in so long. And she said, I actually processed it.
Yeah.
And that's what it's about.
And that happened to my grandfather and with my father. So I know that where they wait kind of until you are ready to let them go. So thank you for sharing all those wonderful stories with us, Dale. I really appreciate it. So that was Sister Dale Heim. Let me just get that surname right this time. Thank you so much once again for all your advice and insight. I think you really opened a lot of minds and touched a lot of hearts today. You really did that to me. You want to greet our listeners and say goodbye?
Thank you, listeners, and thanks for listening. I hope you enjoyed it.
Have a balanced week and remember to be kind to yourself so that you can be kind to others too. Feed Me Honesty is a South African lifestyle podcast hosted by Hazel Priscilla and produced with the generous assistance of Blended Podcasts, brought to you by Blended Audio.